Hi, can you hear me? Hi, can you hear me? Dr. Donna,
Yes.
you can hear me, right?
Yes.
Okay, and I'm just going to share my screen just to let me know if you can see it, please.
Yeah, I can see your screen.
Okay, now the whole screen is visible, right?
Yeah, I can see the screen of the laptop. The
Laptop. Okay, that's
screen,
fine.
yes.
That's all. That's all. Because I'm doing it for the first time from my side. There's nobody helping me, so I thought I'll take little help from you.
It's
Thanks a
very
lot.
much audible and very much visible. The
Great.
clarity
Thanks
is
a lot.
good.
Thank you.
Yeah.
Thanks a lot. So we'll begin at 2 o'clock, 15 minutes. I'll just wait for people to join in, and that's
Okay.
all. Yeah. Thanks a lot. Thank you.
Okay. Bye.
Hi, everybody. I am going to start now. So whoever has come, yep, we'll start on time. I won't be taking much of your time, and we're going to do a very small discussion on the exam, the pattern of the membership in the specialty of prostho, perio, and endo examination. What is the eligibility criteria, and what all you need to study, and how you can appear for the exam. Dina, can you hear me right? Okay, cool. So I will just jump on to a small presentation. I've just made 4 or 5 slides. It's not like a big thing, and we will quickly finish it so that I would not take much of your time. Okay. All right. So I will just share my screen and we will begin. Cool. Again, Dina, is it visible, right? Because there's only one video panelist I have who's helping me out today. All right, cool. So this is a small thing. I will just let you know what I did, what made me reach where I am. It's not like something big, but still it might just motivate you to go ahead and, give some exams, study something, keep updating yourself and make yourself more better at what you are doing. So just a small introduction about myself. This lecture is all about introducing myself, and towards the end we're going to take you to the aspects of the exam and the general requirements for it. Now the only thing for this exam is only can be given by people only who have done their masters in prostho, perio, or endo. Anybody they have changed their criteria very recently in terms of their eligibility. The exact definition can be checked on their site, the Royal College of Edinburgh. Again, there are many colleges conducting this exam. I am going to be talking about the Edinburgh exam, and that's what is going to be discussed today. So there is a Royal College of England that conducts the same exam. There is Royal College of Glasgow that conducts the same exam. You can appear for any exam. The pattern is a bit different, but it's mostly the same. So I have done my membership. So my journey started in 2002 in Manipal. That's where I did my undergraduation from. This photo is from 2017 when I went there to give a lecture. I did my master's in 2008 to 11 from Savita University in India, Chennai. And I'm thankful to my guide who's sitting in the center, who actually pushed me to give that exam. I mean, without her, I would have not known about this exam, because in India, as we all know, in India, I don't know about the other parts of the world, but in India, this exam is not that common. People don't give it. And probably in 2011, I was the first one who appeared for this exam, studying in India. I mean, doing masters in India and then going ahead and giving this exam. So in 2011, I went to Cairo. This is a photo where I went and gave the exam in 2011. At that time, Cairo was a center, but now Dubai has become one of the center for the examination. And you can come to Dubai and give the exam, or you can choose to give the exam in Edinburgh. But my suggestion will be to choose Dubai as one of your centers rather than Edinburgh. So Dubai will be one of your centers where you can give the exam, and you might see me examining you. Maybe if at all you come to give this exam. I got my fellowship in 2018. Same year, my wife got the MORTH, that is membership in orthodontics. So we both went together for the ceremony, and it was a good experience. And 2019, I started my veneer courses. So these are, I do them a couple of times in a year. But unfortunately, this year it couldn't happen due to the coronavirus. Right now, I'm associated with the Royal College of Surgeons as their examiner, and I examine for the membership in prostho, perio, and endo exam, mainly for the prostho section. I mean, I have a bit of idea about the other sections. I can't divulge a lot of details being an examiner, but I'll still let you know what questions were asked to me, and that I can definitely tell. What is expected out of a candidate when they are going to give this exam, and is it a really difficult exam or it is not a difficult exam. The logo of the Royal College changed a couple of days before. I mean, they earlier had a knife, but now they have changed it to this unicorn. And I mean, there's a bit of history associated with this symbol, but I won't bore you with that. You can definitely read it online. And finally, in 2020, I was awarded with this. And I mean, again, nothing big, but yep, looks good, sounds good. And it has helped me quite a lot with my branding. So yeah, nothing to boast on this. I work in Dubai. I work in Dubai Mall Clinic, and I work with a group called MediClinic. I do a lot of general dentistry as well. It's not like I do only prosto. I love general dentistry. I love doing endo. I love seeing children. So, but I mean, of course, prosto is the crunch, and that's what I am good at. So that was the old symbol, and this is the new symbol for the Royal College in case you get confused if you see anywhere else. Cool. So now I'll directly jump on to the concept, the eligibility, and what all is required of a candidate when they are appearing for the exam. Now, this exam is generally conducted 2 or 3 times a year, sometimes in Edinburgh, sometimes in Dubai. The other centers that they have in Singapore and other UK cities, we are not eligible to give. It's only for the students of that particular university that can appear in a Cardiff center or Singapore or London. So the centers that are open for other students are mainly in Dubai and in Edinburgh. So you can choose whichever center you want to go and give the exam. Dubai is more better in terms of the multicultural candidates that come and give the exam. So, you don't really have to, but in UK, if you go to Edinburgh, it's mostly their own students. So, I mean, it's not difficult, but yeah, I would still prefer choosing Dubai as a center. So if you choose Dubai. Then again, the passing percentage of this exam is not that great, but that doesn't mean that the exam is difficult. The exam is very basic. You are not expected to know a lot in terms of recent developments. You don't need to talk about digital technology. I mean, for any simple case like chronic gingivitis or a chronic periodontitis, if you study more, you will directly jump onto a treatment plan of all on four say. You will be like thinking, oh, this is the best treatment plan for the patient. We extract all the remaining 4 or 5 teeth and go ahead and put 4 implants and the patient is happy. Patient is happy, you are happy, but the examiner is not happy. The examiner would want you to go and tell them, that, okay, this is the condition. We can save these teeth. You need to do oral hygiene. You need to save them. Start with overdenture. Start with overdenture as your first line of treatment if only 3, 4 teeth are left. Don't directly jump onto something very aggressive, because that's not what we are expecting out of you. I mean, of course, we keep reading new stuff. We keep seeing new stuff. But overall, British curriculum, we expect basics, and so basics needs to be strong. You don't really have to answer in, I mean, if you answer yes, if you answer good, you're going to go to recent advances. But then if your basics also are not very clear, I mean, nobody cares if you are very well versed with the recent advances. So the basics are very important. The exam is only relevant for people who have done a 3-year full-time training in perio, endo or prosto, or who have done a part-time training. There are some institutes who say that they train you for this exam, but I think that is not right. It doesn't work. The college has become really strict about that. So you should have done a master's or 36 months full-time course, and you can apply for the exam when you have completed 30 months of your course. So in your last 6 months, you can apply for the exam. Things have changed a little bit in terms of the pattern of exam. So when I went and gave the exam, we had to show 4 cases of ourselves, but now that component of the exam is completely removed. So now you only have a written component and you have the oral component. So you can, and you have to pass them individually. There is no compensation between the written and oral, even though there might be a slight compensation happening between written and oral and oral. But if you score really good in written and if you are not scoring well in oral, there is no compensation. So you have to pass the written individually and you have to pass the oral exam individually. If you fail any, this was a question that was asked on email to me. And I mean, if you fail written and you pass oral, doesn't matter. You will still have to give the whole exam next year. So there is no exception to any of the components. So the 2 written papers are mainly now specialty based. So if you are a prosthodontist, the paper will be directed more on prosthodontists. If you are a perio, similarly, the questions will be directed to perio. Roughly 10 questions, short answers. You don't have to write stories. You won't have enough space to write stories. There is no point in writing stories. It's not like a postgraduate exam in India where you can write long stories. It doesn't, I mean, we have our key. We have 8-10 points for an answer. The points have to match. Okay, and there is no past papers available anywhere. So I will anyways let you know few books that you should consider reading. which will give you a rough idea of the questions and how to prepare. But at the end of the day, the basics have to be very clear. I'm again and again telling you, don't really need to know the literature barring your specialty. So if you are a prosthodontist, know the literature of prosthodontics. If you are endodontics, please know the literature of endodontics. You don't need to worry about the other two specialties knowing the literature. And literature also, I would feel you will be beneficial if you find some British articles, British authors, so that the examiners know the name. So I mean, you can always write any research, but if you write a British article, it matters slightly more. So it makes life a little easy if you know British articles, if you have access to British journals. If not, try to get the access to the articles. And so that's the basic crunch of the exam in terms of the thing. The eligibility, I've told you, very strict, 36 months full-time course. Any courses that you have done which certify you as a 36 months course, you will have to send it well in advance to them with all your logbook, with the sign of your supervisor. And if the college feels that the course is genuine, then you might be allowed to sit for the exam. But if you have done masters, which is a full 36-month course, it's not a problem. You can send it well in advance of the date for them to assess your degrees, and then you can apply for the exam. In terms of the syllabus, nothing much is available anywhere. So I will just take you through some of the books which you should ideally know. I mean, again, if the first book which is there on the left, Wamsley, this is the book you should start with. All right, this is a book everybody should start reading if they want to appear for this exam, to get a basic outline of the exam. This is a book by a British author. You get a rough idea about type of questions asked, type of case presentations, how you are supposed to present the case that is given to you. Oh, I'm sorry, I forgot to tell you the other component of the exam, which is the oral component. So the oral component, the written component is 2 papers, 2 hours each, roughly 10 short questions, each with equal marking. So, and you don't really have to, you just need to know the basics. Don't try to, write things which are not very relevant to that question, because it will not really matter. Okay. So, but write something. Don't leave anything empty, because there is no negative marking. At least write something out of 5 lines. Even if you have the 2 key points correct, you get some marks. So that is better than leaving a question empty. It's not a long paper, so you will have enough time to write, but be quick. The Wamsley, the Restorative Dentistry, is the book that you should start with. Don't worry about any other textbook initially. Get a hold of this textbook, read it maybe twice. Then once you are done with it, you come on to the specialty textbooks. So I will not talk about the specialty textbooks. So if prostho is your specialty, you should know through and through of prostho, from techniques to classifications to treatment options, treatment planning, everything. But for perio and endo, like if you are a prostho, for perio and endo, you should know only the basics. That is diagnosis, treatment planning, and maybe the complications and few classifications. You don't really need to know the procedure bit of endodontics or procedure bit of periodontics. Nobody's going to ask you in a prostho exam if how will you do a Widman flap or how will you prepare a root canal? What are the techniques these days? Nobody's going to ask you that, because that's not your specialty. But in prostho, yes, they might ask you, okay, can you just help us design a denture for this patient? So, so if you're a prostho, everything about prostho, basics of perio and endo. Similarly, if you are a periodontist, everything about perio, basics of prostho, basics of endo. Somehow I feel this exam is a bit easy for prosthodontists, because as prosthodontists, we study a bit of perio, we study a bit of endo during our course. But as a periodontist and an endodontist, nobody studies complete denture at all. Okay, so that is a bit of a hassle for endodontist and the periodontist. But again, it's not like something not doable. Pass percentage, again, not that great, but don't get disheartened with that. I had a chat with somebody today. Somebody wanted to ask me about this exam. What is the benefit of giving the exam? Everybody wants to do something, trying to get a benefit out of it. So I will tell you very frankly, there is, apart from recognition, there is no benefit. You can't practice in UK with this exam unless you have cleared the base, unless you are registered with the GDC. So if you're not registered with the GDC, this exam is of no value. If you think that this exam is going to give you edge in the Middle East countries, again, I mean, it might, but it might not. So don't get disheartened with, the fact that, oh, I gave the exam, I spent money, I failed once, I passed, or whatever it is, and still I'm not getting any job. I mean, that is very irrelevant to this exam. This exam should be given for the sake of experience, for the sake of knowledge. And I mean, if you pass, you get an accreditation, you get a full library access with all the journals for the year. So you have the access to all the latest articles for you to read. That is a big thing to have with you. And so, I mean, uh, don't give this exam. I'm very frank with you, thinking to get a benefit out of it. So when I gave the exam, it was just because my guide asked me to give that exam. I didn't plan that I had to move to Dubai, or my plan was always to go and open my own clinic. But I mean, things work out sometimes. So it might work out for you also. But I mean, don't give this exam for any benefit in your head. Otherwise, you might get disappointed. But it's a fun experience. It's a good experience to have, uh, to see how British exams are conducted. And it gives you an edge. I mean, it might not open a door for you, but if a door is open, you might be the preferred candidate to enter that door. So, I mean, that might be the scenario if two people are applying for the same job. Anyways, so these are the basic textbooks for endo, perio, and for prosto, of course, Deepak Nalaswami's book. This gives you a good rough idea about all the things. I will not say to read. I mean, because prosto is quite wide in terms of textbooks. You have removable, you have fixed, you have implants. So I don't really need to read everything being an endo and periodontist. Get a rough idea from this book, and it will be. This book is actually much more than what you need. So you will need to know just the basics, as I have told you. The three books that I have mentioned here, clinical cases, and clinical cases, you can read all the specialties can read all the books just to get an idea about what are the complications, how to manage those complications. They might give you an x-ray. I mean, I'm going to come to the questions that I was thrown at, but I mean, you need to read these books to get a rough idea about how to plan your oral exam also. So once you have an oral exam, you will plan it better. So they can give you a case, you will know how to talk about it. You will not just be haphazard in any way. You will start in the correct order. What is the diagnosis? How did you come to that diagnosis? And what do you think is a treatment plan in order? So you always start with the least aggressive treatment plan and go to the most aggressive. Never start with the most aggressive treatment plan and come to the least aggressive, because that's not the right order. So don't directly in a full mouth case jump to, or we will do crowns on all the 28 teeth. I mean, that is too aggressive. You're going to start with composite. We're going to start with, inlays, then onlays, then crowns. So if you just directly jump onto crowns again, I mean, though it is not a wrong treatment option, but it's very aggressive. So we don't want aggressive treatments, simple basic treatment options for all the cases. So I will just let you know what was asked during my exam, so you get a rough idea of the questions that can be thrown at you. So my cases I had my 4 cases. I'll show you one of my case. You'll get an idea about how to prepare for cases, how to plan during that oral exam. So the oral exam is 2 component. One is short cases and one is long. In the short cases, you won't get any time. So you are given in half an hour 4 cases, 7.5 minutes for each case. You will be thrown a picture, you will be thrown something at you, and then you have to just answer. So it might be anything. Okay, it might be anything from fractured instrument to an obturator. Okay, so I'm telling you both these because both of these came for me. Okay, so I had an X-ray with a broken instrument. I was asked, what do you think it is? I had a tooth with a big amalgam restoration. I was asked, what do you think, that why is the patient having pain? So, I mean, there are few things. If your theory happens first, you might expect some questions of the theory being repeated in the written. If your written happens first, you might expect some questions to be asked in theory pertaining to that theory exam. So the questions are kind of there in both the theory and viva. So if you have not answered something very well in theory, go home, read it before your next day of the exam, so that if they ask you that question again, you know the answer. So at least, they understand that you have taken effort to know that what you didn't know on day 1, you know it on day 2. So the best thing about that is I mean, just a pep talk in terms of the exam. It is not a difficult exam. It's not a very expensive exam. But yeah, basics should be very important. You should stick to basics. Don't read too much, because the more you read, the more you are going to, try to think on that day. And your mind is going to tell you something. Your heart is going to tell you something. So I would not suggest that. I mean, my suggestion to everybody who's giving this exam is don't study too much, because the more you study, the more you're going to get confused. It's more about the code of the exam than the exam itself. So please don't study too much, and don't go on to reading too much of fancy stuff, because that's not going to help you. Don't, I mean, if you tell them I will do a digital smile design for that patient, it's of no use. You have to talk, we'll do a wax up, we will do a mock up, we will do whatever it is. I'm just telling you in terms of something that just came to my head. So I mean, it's all about the pattern of the exam. So by chance, if you don't clear it in one time, I'm 100% sure you'll be able to clear it in the second time, because in the first time you will know the pattern of the exam. And it's all about knowing the pattern of the exam. When I went and gave the exam, I mean, I had nobody to know anything. I had absolutely no idea about what I was going through. I never thought I would clear that exam in the first attempt. Even everybody around me thought that I won't be clearing that exam. I mean, because it's for the first time anybody would have been going to give that exam. But few tips and tricks helped me there. Somebody told me this, what I told you, that the questions are repeated in theory and your vivas. So whatever was asked in my viva and in other people's viva, which I got to know, I just went to an internet cafe at night in front of my hotel and did a study for around a couple of hours. So that helped me in my theory. Similarly, somebody told me the questions are repeated. Now that is of no use, because when I gave the exam, the quarantine was not that strong. But now if you give the exam, from past 2 years, the students are not allowed to interact. So the people who give the exam are taken into another room. You're not allowed to talk to them. But when I was giving the exam, some people came out and they were discussing what were asked to them. And somehow the same question got repeated to me. So I was a champion when I went inside. So, I mean, it's things work out and you don't really know. I mean, if they would have showed me that case of big amalgam restoration and asked me, what is the cause of the pain, I would have said irreversible pulpitis. I would have never said a cracked tooth. But that guy told me that it was a cracked tooth. So when they showed me that photo, I was like, okay, ask me the question. I was like, okay. I said, yeah, it's a cracked tooth. I mean, then the tone is set. So, I mean, you don't know what is going to help you, who's going to help you. I am there here. If you have any doubt with any questions, I can definitely help you out with it. You can't divulge much of the information being an examiner, but still, for motivation and for knowing the basic stuff, I am there. You can contact me on my Instagram. I'm always available here, or on my LinkedIn account, whichever is convenient to any of you. And I would show you quickly one of my case. So you see how was the case presentation at that time. Okay, so this was one of the case which I presented it. This was the case of congenitally missing lateral incisors. So, I mean, this is how we had to prepare it. And this is how you should be presenting it. So you should tell what are the features. So in the long cases, you will be given 15 minutes to read a case. So you will have 15 minutes to prepare this kind of a case history. So you will write the notes on a paper, and then you go in for a 15-minute viva on that long case. So there are 4 long cases that happen over a period of half an hour, 2 cases, then you get a break, and then you have half an hour, another 2 cases. So you have time to go through those cases, sit and plan. Read about the basic periodontal examination. That is important. The classification has changed recently. It was way simpler before. Now they have made it way too complicated. But even if you know the basic BPE, I think that should be more than enough. Photos, of course, now you might be given this case only. I mean, you might be given a case like this, photos like this, and then you have to just tell the treatment options. So in a case like this, I would not want you to jump directly for implants. Don't directly jump for, I mean, assess the age of the patient. If the patient is very young, then you would definitely not want to jump for an implant. You will start with a resin retained bridge. Okay, so resin retained bridge is the first answer that should come out of your mouth as a treatment planning for this case. Second option, I mean, of course, implant is there, but again, implant is considered more aggressive, even though that is the better treatment option right now. If you ask me, I would also say implant is a better option. But young patient, you would do a resin retained bridge, wait for the growth to get complete, and then you go ahead and put in an implant. So if you say implant and then you sit like this without saying anything else, I mean, that's not the only treatment option. So you should have an array of treatment options available, again, starting from the least aggressive, going on to the most aggressive. So, and then in each of these questions, you might be asked about the, what do you call, the evidence. So in your long cases, it will mainly be your specialty cases, and evidence might be asked. So evidence is important for your specialty, and it is not generally important for for you to know any other specialty. And if by chance you don't know anything, write something in theory. Don't leave it empty, because that is definitely going to give you 0 in that question. If you write something, you might score something. Okay. And it's a matter of very few marks which decides your pass and failure. So you need to write. Don't leave a question. Don't be in a hurry. I would suggest read properly the questions. Case planning is very important. Don't be aggressive. Last time when I was an examiner, there were candidates who were very aggressive. There were people who were, again, jumping onto aggressive treatment options, which is not the right thing. Because that's how we are taught, and that's how we see these days. All these talks, all these webinars, they all just pump you up with the aggressive treatment options. So my options will be, again, stick to the basics. I am a very basic person in terms of my treatment plannings. I don't have an access to an intraoral scanner also. But I mean, you can deliver any result without any extensive technology helping you. So don't, I mean, my suggestion is just to read the basic textbooks. The books that I've showed you, start with the Wamsley textbook. That is important for you to have a rough idea. And then you can build onto it and give the exam. So I will close my screen share now. And let's see if anybody has asked any question. There was one question. Somebody's asked me about MPEDS. I mean, MPEDS, again, I am, Dr. Mandeep, I am really sorry regarding that. I will have to find out for you. MPEDS is a that much I know, that it's a tri-collegiate exam. So you have the chance to appear for all the 3 colleges together. And then once you appear for all, you can choose in the end, if you clear, which college you want the degree from. But as an aspect of what is asked, I'll have to probably look for somebody who has done it and get back to you. So in terms of MPEDS, not really much information, Dr. Mandeep. But I will surely find out for you. And if anybody has asked anything here, no. So if anybody has any question, can can raise their hand on the chat window, and I can definitely help them out. Or you can message me on my Instagram and I can help you out on that. I hope it was of a little worth. I mean, I know I'm finishing it very soon, but I don't want to waste your time as well. There's nothing much in that. And if you have any questions, I can tell you. Sir, can you tell me how can I give DHA as a prosthodontist? I mean, again, this is not very relevant to this topic, what I'm discussing. But I mean, if you have studied in India, then you will have to have a 3-year experience. So you'll have to go to the DHA site, see for your college name, see your country name, see the requirement, the amount of experiences that you have. And then if you have that experience, you can just apply it to the DHA site and give the exam. It's a 70 MCQ exam, not very difficult to get the license. Getting a job might have to struggle a little bit, okay? But you will get it. No, we don't need to prepare any cases. Just book and go for it. Yes, the case aspect of the exam is removed. So Dr. Azim, you don't need to prepare any cases anymore. You just need to prepare yourself and go for the exam. There is all what is asked is given to you on the day of the exam. For student textbook, again, if you are an endodontist or a conservative dentist, you have to read the book. For a prostho and perio, I don't think you will have to read the whole book, because you will just keep reading that book only then. So again, I'm telling you, don't worry so much about going into the depth of the procedures. You're not asked to do any procedure. You will not ask a lot of details. The strength is in treatment planning, diagnosis, and complications. That is what 3 things that you should be very, 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 very aware of. How much is the cost of the exam? Keeps changing. When I gave it was £750. Now I think last I saw was £1950. But I don't know the next exam how much they are going to have the price for. The paper which we prepare for long case, they collect back. Yes, it's not used for evaluation. Nobody's going to see that paper. So don't worry, whatever you want to write on that paper, it's going to go in the dustbin. Even if you scribble on it, it's fine. You draw animal on it, doesn't matter. Okay, but what you answer is the what matters there. And other MRD exams available without the 3 specialty split. I mean, there is no MRD is restorative dentistry. It's a specialty split exam. If no question banks, Dr. Marina, you will have to just read. Unfortunately, there is no question bank available. There is no past paper available. There is a blueprint available, which you can see what you are expected to know. But I've told you what is expected out of you. So don't worry about, too much. Theory paper involves, yes. So if you are a prosthodontist, out of 10, you might have 8 questions of prostho and 2 of restorative dentistry or some general dentistry questions. Similarly, if you're an endo, out of 10 or 11, 7 or 8 might be prostho or perio or your specialty. And the other might just be some basic questions like allergy or something like that. So, I mean, it might be anything. All the specialties have their own exams. Pedo have their own exams. Oral surgery has the exam. Ortho has the exam. The exams are very similar, same almost pattern. Again, don't study too much. That is my advice. You will thank me for that later. And I am pretty sure anybody who gives the exam will have a good experience. I mean, it's not a bad experience to go through. I think I've covered everything. Anybody's typing anything? Somebody, yeah, I have. MSc and endodontics to give 1 year MSc is not eligible. There is no 1 year MSc in endodontics. MSc has to be, I think it's a 2 or a 3 year program, and that you'll have to check with the college. 1 year programs are not eligible for this exam. The website is rcsed.ac.uk. That is a website that you'll have to go through. How did I become the examiner? I mean, I became the examiner after waiting for a period of roughly 7 years. And there's a requirement that comes up. The requirement comes up on and off if they need an examiner. So I had my membership, I had my fellowship, and I had my cases, I had my courses, I had my CME points. So we sent everything together. There is a couple of letters you need, recommendations. I sent everything, and fortunately they chose me. So yeah, that's how I became the examiner. And now I'll be grilling some of you whenever you give that exam, maybe, if at all you come to Dubai. RCSED, you did MPROS, yes. So after doing membership, if you wait for 5 years, you can apply for FDS without assessment. There is no exam for that. But you need to have a strong CV. You need to have a strong growth in the past 5 years for them to choose you for FDS, especially the last 2 years. So if you are doing in 2020, you get your membership in 2020, 2025, you can apply for FDS. And once you apply for FDS, if your CV is strong, you get the thing. The link, I am typing it here. So you can see, this is the link that you have to go through. This is a site for the Royal College of Surgeons, Edinburgh. And you can go on this site and choose the exam. Dates are not available right now. So whenever you will get a date, you can get an, I think they have launched an app also recently. You can download the Royal College app and do it. After MDS, how many years one needs to have to give MDS? No, I gave it immediately after my master. So you don't really need, that's what I told you. In your 30th month of your post-graduation, you can apply for it. So even after immediately, I think the best time to give the exam is immediately after master. So when I gave the exam, I hardly have to study prostho because I was very fresh with prostho. I had just given my master's exam. So whatever I had to study was perio and endo. And that also, trust me, I didn't study anything. I mean, I won't lie to you. There's no point in me lying to you. That one book, that Wemsley, that book I showed you, I read that and went. I started with Nisha Garg. I started with this endo book. I started with Carenza, but they are so huge books that ultimately you will feel frustrated. So that's what I'm telling you. I had no clue that I will clear that exam. Some things helped me during that exam, like I knowing the case before I went in. So that was the confidence builder for me in my Viva. The cases that which I took, I was very confident about them. So because I did those 4 cases, so anything in those 4 cases, I was able to answer very well. Written was, again, I read 3 hours before my written paper. So whatever questions I was able to hear in my theory paper from other candidates also, and which I didn't know, I mean, I had read about it, and in the written few of them came in. So it helped me. I So as far as I remember, I think I got 24 out of 28, and out of to pass, you need minimum 21 at that time. Now you need to have 3 out of 4 in each section to pass the exam. So it's not a very easy exam that ways, but it is not difficult in terms of what you have to study. Dr. Rizlina, MPerio exams, I don't really know what you want to ask regarding that. MPerio is similar to MProstho, Endo. It's the same exam. Oh, something was coming, sorry. Basic of Prostho, basic of Endo, written question will be around 30%. I told you roughly around 10 questions, if they are there in a 2-hour paper, 8 out of 10 will be perio based. 2 out of 10, maybe you might have some syndrome or something like that coming in. So, which might just blow your head off, but it might not be still difficult, and you don't leave it empty. So please write something, make a story if you don't know anything. Okay. Don't leave it empty. There were a lot of papers that were empty when I was checking this year. So please. M-Orth, I will ask my wife, Dr. Kavita, and tell you, I have no idea about M-Orth, but still don't study it so much. She studied 16 textbooks. That's what she keeps telling me. But eventually you don't need to study so much. So it's more of the technique of the exam rather than the knowledge that you have. Don't get confused. Don't read too much. Don't read too much. Don't read too much. Yeah. Okay. Any other? People are typing. Nobody's typing. Somebody came. Basic questions will be basic science or basic of endo. I mean, it might be an allergy related question. So if you consider that as basic science, I don't know. Local anesthesia, everybody knows. You should know about it. Latex allergy, everybody should know. You should know about it. They are not going to ask you the biochemistry or microbiology of a virus for sure. It's not that basic science, but it will anyways be clinically related. It will not be anything non-clinical. It won't be physiology. It won't be microbiology. It won't be biochemistry or anything like that. It will just be simple clinical science. Dr. Dina, shall we go, or we should wait for more questions? Any more questions? I mean, it will be great if you can write 5 more minutes. Okay, 5 more minutes, Dr. Dina is saying. So I'll wait for questions if anybody has. This is the first attempt I'm trying to do a webinar on my own. There might be some glitches, and I'm sorry for that. I always used to do with somebody else, but it's the first attempt at doing myself. I'm going to come up with more lectures, more clinical lectures on photography like this. So if it was okay, I mean, if you guys can give me a thumbs up or write a small, message on Instagram, it will be great. I mean, it will be a good motivation for me to come up with more of these stuff. Simple half an hour lectures, nothing fancy, nothing really, that you cannot do every day. So if you have time, I mean, I'll just show you one of my case, which I finished very recently. If you would want to have a check of the work and how technology doesn't make you, not having it shouldn't stop you. Okay. So I'll just show you a case which I did recently. This was a full mouth rehabilitation case. All right. I will directly take you up. One more thing, please keep taking records. I mean, unless you take records, your life is incomplete in dentistry. Even I'm not saying to have something fancy. You can have basic camera, basic, mobile phone, but take photos. I mean, you will not get these kind of photos with a mobile or a simple camera, but still a photo is better than no photo. So, you should have a record. It teaches you, it makes you realize your mistakes more than anything else. Okay. So just to take you through, it was a case of full mouth rehabilitation. We just finished it last week. Direct mock-up I do always for all my patients, just to see, take some photos while function, take some photos. I have not put a video in it, but I have a video as well. So these are the pre-op conditions, pre-op condition of the teeth. We have I did 2 implants on the left side, 2 I did last week on the right side. The rehabilitation of the implant is left. I'll be doing it maybe after 6 months. Facebook transfer was done, centric was recorded. We had all the records sent to the lab. The lab does a wax up based on what I asked them to do. We do a mock-up for a patient, looks happy. Any adjustments that we have to do, we do at this stage. At this stage, the patient should know what the treatment is going to happen. You cannot diverge from your treatment plan beyond this stage. So if you have convinced the patient that you are not going to do any surgery, you cannot tell the patient after 3 appointments that you are going to do a surgery of gingiva. You think that will look better. So your patient should know at this stage that, okay, this is my treatment plan. I'm going to have 10 crowns, 5 veneers, no surgery, some surgery, whatever it is. Mock-up done. The only 4 burrs I use, there is nothing else I use. If you have any extra burrs in your armamentarium, you can throw them. You don't really need all those fancy burrs. These for crown cutting. For cavity cutting, of course, different. But for crown prep, you only need these 4 burrs. There is nothing that you will need more than this. All the preps done. Margins mostly supragingival. Hardly I've gone some gingival anywhere. All shoulder. I always prefer shoulder margins, rounded ones, nothing else. All the other margins are for textbooks. You can choose the only rounded shoulder margin is good for most of your cases. All right. The lab is excellent. I get good results from the lab always. So we have all crowns are individual. Never join 2 crowns together. In the exam also, if they ask you whether you join 2 teeth together, please say no. Even if your mind is telling you that you always do that in your clinical practice, but don't tell them. It is a wrong treatment option. You never join 2 adjacent teeth together, be it for crowns, even for an FPD. So you don't double abut teeth. That is a wrong concept of treatment prosthodontically, and don't do it. So these were all the crowns. I mean, some photos, what happened? Yep, the articulator, my preparations, preps. I'll just show you the final result quickly. So this is in the mouth 1 week after cementation. The gingiva is excellent, no black triangle, and I'm 100% sure this is going to remain like this because of where my margins was placed and how it looks, because I've removed the temporary on this day. So if my temporaries have not caused any gingival inflammation, I'm 100% sure my final preps are not going to, give me any gingival inflammation over a period of years. All are layered zirconia crowns. There is no Emax in this because the patient was bruxist. Final result, before, after. This is a smile that you should get from the patient once you finish the treatment. This is a very important photo. So when you are taking photos, always have, initially also, you should have a big smile, try to make her laugh, train your assistants to crack some jokes and make the patient laugh to get that photo. So, I mean, yeah, treatment is still going on and we are almost about to finish in a couple of months. So, I mean, and there was no digital work used in this, no scanner, I mean, nothing. So don't think that unless you have a scanner, you cannot do anything like this. The trend is going towards digital, but it's not like if you don't have it, you cannot, give good results. So I always promote basics, and that's what is required because, I mean, we tend to flow with the technologies and kind of feel demotivated. So, you can do everything with the basic stuff. Cool, then. It was lovely. Thank you so much, everyone, for staying. Which camera? I use Nikon D7100 and 108 macro lens with 2 flashes and it's called a Mega Mod. It's like a soft box for the soft kind of box for my flash. These are Godox. No, not twin flashes. I stopped using twin flashes because using twin flashes kind of gives me a bit of error because every time I move, the light moves with me. So every time I have to keep adjusting. So I have 2 flashes that are kind of fixed. The patient is fixed. Even if I move, the exposure of the teeth is fixed. So I've shifted to my standard 2 flashes. I'm not using the twin flash anymore. Cool. We'll be having a photography lecture soon. I will plan for it for sure, just like a discussion. And we'll see you again. I think there are 1 or 2 more questions. Sorry. Quickly, I will do with medical emergency. Yes, they can ask for sure, but not in detail. UK specialty based syllabus is what we need. Yes, you need to look at that. If you can get a hold of the specialty syllabus from UK, that's what you need to know. Did I give her a Michigan splint? No, I gave her a temporary for a prolonged period of time. So my temporary acted as a Michigan splint, and I had a broken temporary once or twice, but that's okay. So you can give a Michigan splint, or you can give a temporary if you are sure. And if the patient is not going, if the patient trusts you and she is okay for the treatment, you can directly go for preps and attempts. But otherwise, Michigan splint is a good idea. Can we give exam after 3 years after completion? I think you can. There is no time frame as such mentioned on the site, Dr. Shazia. So you can definitely apply for it. There is no, but you might need to get a letter from the college, and you might need to get a transcript from college to tell that you have done a 36-month course. Cool, lovely. Thanks a lot once again, and see you. And any problems, you can please Instagram me, and I will help you out with that. I'll end the meeting. See you. Bye-bye. Thank you, Dina. Thank you.